Today we'll be supporting activities of daily living in the home, a guide for caregivers and partners in care. We'll be looking at helping someone with dementia with the task of toileting. The presentation today was developed in partnership with PhysioCare at Home, Nova Scotia Health Authority, Dalhousie School of Occupational Therapy, and the Alzheimer's Society of Nova Scotia. Today we'll be looking at toileting from start to finish. There is a pre-education survey specifically for caregivers, which you will use a scale from 1 to 5. 1 looking at from very little knowledge to very little confidence, to 5, very much confidence and very much knowledge. So rate the following when helping somebody with dementia with the task of toileting. So today we'll look at the overview of dementia. We'll look at dementia and Alzheimer's disease. We'll look at symptoms, physical abilities, and behavior, and specifically looking at person-centered care. We'll look at the introduction to the clinical frailty scale, communication, practical tips for helping people get up and get to the toilet, and as well as hands-on techniques for transferring someone. Mobility aids will be used as well as assistive devices. Before we begin, however, I think it's important to consider that people with dementia are no different from the rest of us. They need caring people to help them to stay relaxed, to feel safe, and to maintain their dignity. They want a sense of purpose, and they need to have not just a sense of purpose, but significance as well. So their perception of reality can be quite different from ours. This doesn't mean that they're wrong, it just means that their context is different. What is dementia and Alzheimer's disease? So dementia is a set of symptoms, or a syndrome specifically, which looks at a consisting number of cognitive or thinking symptoms. So these symptoms can include changes in a person's memory. It can include changes in judgment and reasoning, as well as calculation, and also changes in mood and behavior. And I think one of the most important things which occurs with dementia for people specifically is their change in ability to communicate. Alzheimer's disease is the most common cause of dementia, which represents about 65% of the known dementias. So what is Alzheimer's disease? Alzheimer's disease is a progressive, degenerative, irreversible dementia. There is presently no known cause or cure, and the damage done to the brain cannot be repaired. Brain cells shrink or disappear and are replaced with plaques or thread-like tangles. And it's important to note that dementia is not a normal part of aging. Alzheimer's disease typically follows certain stages which will bring about changes not only in the person experiencing or living with the disease, but also in the family members as well. Because the disease affects each individual differently, the symptoms, the order in which they appear, and the duration of each stage vary from person to person. In most cases, the disease progresses slowly, and the symptoms of each stage may overlap, often making the move from one stage to the next stage quite subtle. As the disease progresses, the person's abilities will change, so situations that are not of concern today may become potentially safety issues in the future. There are other types of dementia. Vascular dementia is one of those types of dementia. And vascular dementia can be the result of a stroke, or it can be the result of a series of small strokes. The symptoms may affect a person's ability to walk, cause weakness in an arm or a leg, and may cause slurred speech or trouble speaking. Frontotemporal lobe dementia, unlike Alzheimer's disease, it affects the specific areas of the brain, the frontal and the temporal lobes. These early symptoms may be, the early symptoms of frontotemporal lobe may actually affect a person's personality, their behavior, and or their speech. Lewy body disease is another type of dementia. With Lewy body disease, the symptoms may look similar to Alzheimer's disease, but usually the hallmark of Lewy body disease is experiencing hallucinations, and the progression may be more rapid. So here we have an image of the brain, and in the image of the brain, we'll see the different areas of the brain that can be affected. So the symptoms experienced by the individual depends upon which part of the brain is diseased. So for instance, for people with Alzheimer's disease specifically, the temporal lobe is affected. So because the temporal lobe is affected, if you look on the screen, we'll see that the temporal lobe affects memory, understanding, and language. So the person with dementia may begin to have difficulties with their memory, so trying to recall information, trying to remember, it could be a grandchild's name, it's just not coming to them. And understanding or language is the other part. The ability to express oneself becomes more difficult, and then to understand what people are saying. So now we'll look at some of the symptoms, the physical abilities associated with the changes, and then of course behaviors. So no matter whether or not it's Alzheimer's disease or one of the other types of dementia, there are a number of common symptoms which a person may experience. It's important to realize that not all individuals will have all of the symptoms, or that each individual will have the same difficulty with a specific symptom. Each person with dementia has their own strengths, they have their own challenges, their own personalities, coping styles, and supports. Here are some of the most common symptoms of dementia. So the first symptom that we'll look at is memory loss that affects day-to-day abilities. So that may be forgetting things often or struggling to retain new information. So as the person progresses through the disease, it may become increasingly more difficult to retain new information, to retain that information and to recall it later on. Some of the other symptoms include difficulty performing familiar tasks. So it could be forgetting how to do something you've been doing your entire life, such as preparing a meal or getting dressed. We'll look at problems with language, so forgetting words or substituting words that don't necessarily fit the context. They may not necessarily fit the conversation. We'll look at disorientation in time as well as space. So not knowing perhaps what day of the week it is, or getting lost in a familiar place. Another one of the symptoms which people with dementia will experience is impaired judgment. So that's not recognizing a medical problem that needs attention, or perhaps wearing light clothing on a cold day. Problems with abstract thinking. So from time to time, many of us need some help with tasks that require abstract thinking, such as balancing a checkbook. A person with dementia, they may not necessarily understand or understand what the numbers represent within the within the checkbook. Misplacing things is another symptom associated with dementia. So that may be putting things in peculiar places. It could be a dress in the refrigerator or a wristwatch in the sugar bowl. Changes in mood and behavior. So a person may exhibit severe mood swings from being easygoing at one moment, and then all of a sudden, without a trigger, they may become quick-tempered, they may become sad. And we don't necessarily have a reason for why there's that change in mood and behavior. Finally, not finally, but we'll look at changes in personality. So behaving out of character, such as becoming confused, suspicious, or fearful. And usually the person that they become the most suspicious of is the person that they spend the most time with. Finally, we'll look at loss of initiative. And I think this is probably one of the most important things associated with the disease. We're all social beings, so we need to stay connected with other individuals. When we stop doing that, it affects our personality. I think it affects everything, but that loss of initiative is really important for family members to cue in on. We need to recognize it so that our family members continue to stay engaged in their community, with their friends, and with their family.